Good afternoon. Thank you for joining us on this month's edition of Ask the Expert, the Nutrition Edition. My name's Elizabeth Irish, and I am your host today. I am a registered dietitian with the New York State Office for the Aging and the program manager for the Older Adults SNAP-Ed program. Today, we're going to be discussing diabetes and prediabetes, specifically the myths that surround prediabetes and diabetes. I have two amazing experts with me today, Marie Ochogrosso and Claire DeSanto. I worked with both of these experts in my role as a certified diabetes care and education specialist a few years ago. And I'm not kidding, they are probably the two people who know the most about nutrition, diabetes, and all things related to that I know. So I'm really thrilled to have them here today. I'm going to let them introduce themselves to you, and then we'll get started on our discussion.
Marie, would you like to start?
Oh, sure. Sure, Marie, either one.
So my name is Marie Ochogrosso, as Elizabeth said. So I am a registered nurse and diabetes care and education specialist. We used to be called certified diabetes educators, so you might have heard that term before. I work right now at an endocrinology office. So I'm an educator. So I meet with patients individually, sometimes in a group, and teach them, as Elizabeth said, all things diabetes, whether it's type 1 or type 2, whether it's equipment or medications we're talking about. So that's what I do. So, and thank you for inviting me to this, Elizabeth.
Oh, I'm so glad to have you, Marie.
Yes, me too. Happy to be here. I'm Claire DeSanto. I am a registered dietitian, and I was a certified diabetes educator. So that's the term I was familiar with before joining the New York State. I now work for the Department of Health, and I coordinate, similar to Lisbeth, a SNAP education program called Just Say Yes to Fruits and Vegetables. So thanks for having me.
And you work with mostly young children, right? Or those programs, or is it everyone?
No, the Just Say Yes program, we typically are implementing, conducting workshops in the emergency food network. So through food banks and then out to food pantries and soup kitchens. And so we're meeting individuals in that realm.
I learned something today already. You will always learn something from Claire and Marie, always. So we're going to get started. And I think we'll start with a few slides. Nope, that's not it.
But I like that one.
Going backwards. Oh, well, there we are. That's today, and that's my name, and that's where I work, and that's what I do. So I do want to tell our audience today, if you have any questions, please put them in the chat and we'll answer as many as we can. So I'm hoping you'll do that. We'll keep our conversation lively. Next slide, Roger. Just a few statistics about adult diabetes and prediabetes. I think most of us know someone, whether it's in our family, a friend, a neighbor, a coworker, somebody at our church that has diabetes. So right now, there's 37 million Americans who have diabetes. And 96 million Americans have prediabetes. So it's even a bigger number. And of the people who have prediabetes, 48% of Americans over 65 have prediabetes. And 1 in 3 of us, and that's all Americans, will probably have diabetes or prediabetes sometime during our life if the trend continues, and the trend is going up. Now, the statistics that I just mentioned were actually from 2020, and we know since COVID, the last couple of years, we've seen an increase in incidence, even since 2020. So the numbers are not going down, they're only going up. And we'll talk a little bit about why that might be happening along the way in our discussion. But we'll go to the next slide and talk about some of the facts and myths associated with diabetes, because sometimes that can be a real barrier for people getting the education and knowledge that they need to manage their diabetes if they have the wrong information. And Marie, Claire, and I, we would come across a lot of these myths and try to, help people understand what's true and what's not true about diabetes. So we're going to go to the first myth. If you have prediabetes, you will definitely get diabetes. Now, a lot of people think this. They think it's, a definite, it's going to happen. But it's a myth, and I'm going to have Claire and Marie talk about why it's a myth.
Okay. Do you want me to start, Claire?
Sure.
Whoever.
Okay. So the pre-diabetes, first of all, I just want to be clear about what pre-diabetes is, right? So maybe you're at your doctor's office and they say, oh, your lab test shows that you have pre-diabetes. So usually what they're looking at is either a fasting glucose that might be a little bit higher than normal, but not be in the realm where they would say you have diabetes. So that would be the first morning glucose. They might also have done what's called a hemoglobin A1C, which is that 3-month average blood sugar. It's one blood draw, 3 months average blood sugar. And it will say, it may have you may have an A1C of maybe 6.1. And to have a diagnosis of diabetes, it would be 6.5. So, but the point is that your doctor or someone, your provider might say you have pre-diabetes. So what that means is that your body is not metabolizing sugar. It's not utilizing sugar as well as it did maybe a few years ago. And you're accumulating extra glucose in your bloodstream. So does that mean that you will definitely have diabetes? Absolutely not. What it means is that you are heading down that road. So yes, we need to talk about it. Yes, you may need to make some changes. Sometimes your doctor might even, or your provider might put you on a medication to sort of throw the tide a little bit to turn things around. But with making changes in nutrition, making changes in exercise programs, making, possibly medication, you can turn things around where your A1C would go back to a normal level, and you may never, ever have the diagnosis of diabetes. But usually it would require some attention.
Claire, would you like to add anything, particularly when it comes to the nutrition part? There's sometimes some changes people might want to look at too.
Sure. And I think what was just asked through the chat is a good sort of segue for that. It's what's the best way to put newly diagnosed borderline diabetes into remission? And I think, some of the lifestyle, the behaviors that we're able to adjust to improve our body's usage of sugar would include some of the things Marie had mentioned. So our intake of sugar would absolutely impact what our blood sugar would be. So making adjustments in our eating habits to reduce sugars and kind of reflect on all of the sources of sugar in our diets. It's not just table sugar, but also the foods that we break down, some of them right from the earth. So fruits that we break down would become sugar in our bloodstream. Not to say fruits are bad, but just reflecting on intake and amounts and sort of patterns over the course of the day and the week. And I guess really thinking about even outside of nutrition, physical activity, there's a lot of things that influence how our body digests and processes our food. So stress, our sleeping habits, and sort of thinking about if you have seen changes in your blood work and working with your physician, thinking about what might have been changed in your life the past few years, months, weeks, that could potentially be influencing how your body is responding in relation to its blood sugar.
That's a good point. I can share with our audience that I have diabetes, and when it went from a lower, maybe pre-diabetes level to diabetes was when I was commuting for an hour and 15 minutes each way to my physician. I was under a lot of personal stress at home, Just even commuting, you're less active. I wasn't sleeping as well. You know, all that snowballed on me. Now mine did go quickly into diabetes, but I was able to control it. And we'll talk about that a little bit more down the road in this discussion. But that's, you know, a lot had gone on in a very short period of time that pushed me over the edge. You know, I had been managing it pretty well, and then not so much.
Things change. And I think that's a great point, Elizabeth, because, you know, during this time of COVID that we just sort of are coming out of, you know, things are changing. How many people said, wow, once I got out of my regular routine, you know, my gym closed. I'm now working from home, which I say is really nice to work from home, but it's awfully close to the refrigerator. That's the problem with working from home. So, you know, so weight might have gone up a bit, stress level, really good point, Elizabeth. You know, so yeah, so I think, you know, what Claire is saying too, yeah, look at what happened the last 6 months to a year that might have changed, you know. Someone will say, oh, I had knee surgery last year, and so I haven't been as active, you know, and so all these things can contribute.
Yep, that definitely was a challenge for me, but I managed it because fortunately I know how, but diabetes educators can teach what we know to you. So we're going to move on to the next slide. A lot of people think you don't have diabetes unless you have symptoms. You know, a lot of times people are like, well, I can't possibly have diabetes because I don't feel anything. And that's sometimes you don't feel anything. So we've listed some symptoms here that are helpful to know, but I'll have our experts tell you why that's a myth.
Well, I see plenty of people who are completely surprised by their diagnosis of diabetes. And this could be type 1 or type 2, more these symptoms, more likely that they wouldn't have symptoms with type 2, because things sometimes gradually change. You know, it's so slow of a change that they don't realize that, gee, they are urinating more, they have been drinking more, but maybe they thought, oh, it's summer, I'm not really, you know, I'm thirsty anyway. So it is not, it does not mean you don't have diabetes if you do not have symptoms. For lots of people, the blood test is the first indication. And then maybe in retrospect, they might notice some changes, or it might have realized there were some changes back in the last month. But yeah, it's not always so obvious.
Agreed. And I just was going to point to another question that had been asked through the chat box.
Okay.
So women who had gestational diabetes are often told they're at higher risk for diabetes. Would it be type 1 or 2? And can you change anything about that increased risk? And so I think statistically, it would typically be type 2 diabetes that would be an increased risk for a woman who had been diagnosed with gestational diabetes. And when a woman is pregnant, her hormone levels change in order to build and grow that little human inside her. And so when it comes to insulin usage and insulin sensitivity, there are changes during pregnancy. And so having that condition during gestation would then show that same female might be at risk of sort of insulin resistance in the future as a potential. So is it 2/3 of women diagnosed with gestational diabetes may end up with diabetes type 2, most likely. But just the same recommendations for someone with type 2 diabetes of ways to improve insulin sensitivity and sort of digestion of carbohydrate and sugar. All of the same recommendations, suggestions, behavior changes, adjustments would be helpful for a woman that may have had gestational diabetes to prevent diabetes or to manage a diagnosis of type 2 diabetes.
Yes. Yes. I worked in the field of maternal nutrition for many years, and the placental hormones, the hormones that are put off by the organ that's involved with feeding the baby, while it's inside the mother, puts off hormones that block how well the insulin is used to metabolize the sugar. And sometimes that gets worse as, it increases during the pregnancy as the placenta gets bigger. But when the placenta is delivered, usually it goes away. Not always, though. Sometimes people develop diabetes in pregnancy that does not go away after pregnancy. Maybe they had type 2 diabetes before they became pregnant, just didn't know it sometimes.
Yes.
So, yeah, you always want to be checking with your medical provider. They can provide a lot of information about why these things might be occurring. So we'll go to the next myth. Just want to check the chat. Oops.
Yes.
I
like
is a
this one.
popular thing.
And this goes really nicely with the question, I think, what's the best way to put newly diagnosed borderline diabetes into remission? I don't know. So you hear sometimes about reversing diabetes or curing diabetes. I recently been reading about the word more that's used more these days is remission of diabetes. So once it seems like a hard reality to say, but it's true that once you are diagnosed with diabetes, that diagnosis is not going to go away. We may say your diabetes is really, really well controlled, but you still have diabetes. And the thing is, how is the diabetes controlled? So it's what we mentioned before, so you might look at what you're eating. Are you eating more, carbohydrates, or is your exercise been kind of gone off and now you've gained some weight? So can you make a difference and get yourself into what's called remission, where your blood sugars go back down, your A1C goes back down, you feel better, even if you haven't lost some weight, you might have, the movement might have reconfigured your body a little bit, where you're utilizing your sugar a little bit differently. And so we wouldn't say it's gone for good. That's the hard reality. But the good reality is it can be well controlled for the rest of your life. But if you stopped doing the things that made things better, then could it come right back again? Of course. It's, if the weight comes back up and exercise stops, then the blood sugars can start to creep back up again. So we won't say a cure, but we will say in remission.
Yeah, I guess I could say mine's in remission. I told you about when I developed diabetes, but then I changed the things that I talked about. I moved to closer to where I worked, so I only had a 15-minute drive, and a lot of things changed because of that. And it's been in remission for probably 10 years. So now my A1C is almost to the point where it's not even pre-diabetes. So yeah, I still have diabetes. I go see my provider every 6 months, but it's in very good control. I don't say it's reversed. I just say it's in really good control. Claire, do you have thoughts on that? You probably hear that reversing thing too.
Yeah, I guess I would think about that, I don't think any of us want to be a statistic, and it's hard to accept sometimes that there's something wrong. But I think if we can kind of move past some of those fears, shame, blame, and just sort of begin to gain new information and educate ourselves and become more aware of what does that mean, and what are some of the changes, the behavior changes I can make to improve that. But that's, I think, the most powerful approach you can take for yourself and for your health. And the more success you have in those changes, that hopefully those would be things that you feel better. Anyone feels better with more movement, and hopefully, enjoying a healthful meal, that those are things that you want to continue. Sort of one good habit or change can lead to another and another. And hopefully all along the journey of that, you feel really positive reinforcement from your own body. So.
Right. Oh, I'm sorry. I was just going to say, there's plenty of people who come in and they feel like they've been doing everything correctly. And here they are still with this diagnosis of diabetes, right? There's still those folks. And the thing is, there's this big, strong family, familial component, genetic component to type 2 diabetes that may be coming into play. So it's not, we don't, just like Claire said, we don't play the blame game. We may say what's changed in the last year, if anything, but we don't, because there's plenty of people who are exercising, eating well, and they still end up having high blood sugar, and that feels like they've done something wrong. They've done nothing wrong.
Well, that's true. It's kind of, at first it felt embarrassing to tell people as a diabetes educator and a dietitian who had diabetes. It's like, what? But I also take medication to control my diabetes. So it's not always, sometimes we need help. But we have some interesting questions. Let's see. I was diagnosed with it must be 2 this year, I'm guessing. My doctor wants me to lose weight and more activity. I recently retired and I'm moving more. My question is, should I see a diabetes educator and should I be checking my sugar daily? Oh, we got a myth coming up on that one soon. Should have saved that one. But thoughts on that?
Do that. Do you want to start with that, Claire?
Sure. Well, I'd say absolutely empower yourself with a meeting with a diabetes educator, because you can really customize and talk specifically about your own lifestyle, your preferences for foods and physical activity, what it all looks like for you. And together, kind of collaboratively, and hopefully mostly from yourself, is coming up with goals that will help you make some positive change. And then Elizabeth, I don't know if you want to speak to, or Marie, the other component with testing.
Yeah, so the glucose testing. So first of all, should you meet with a diabetes educator, as Claire said, yes. And just to say, most insurances, vast majority of health insurance covers that visit. I can't help but saying that. In terms of glucose testing, most insurances will cover some sort of glucose testing, whether it's finger stick testing or using what they call a continuous glucose monitor, where you're sort of wearing some sort of patch that's giving you some glucose numbers. The point is, if you don't know, and I will jump ahead to the myth, but if people say, no, I don't need to test because I'll know when it's high and I'll know when it's low. But the problem is there's a lot of in between high and low that we want to see where your blood sugar really lives. And so we do ask people to test first thing in the morning, maybe 2 hours after a meal, even if you test twice a day, you don't have to do it 8 times a day necessarily, but it's so helpful. When people say, well, I know when I'm high. Well, if you feel you're high, then likely you're very high, maybe over 250. And if you feel you're low, then maybe you're 60 or even 50s. So it's just really important to not wait for those extremes, but to actually know what your blood sugars are running from day to day, to know, is the medication working, or the treatment that you're on, or is exercise helping, or the foods that you're eating, how is your body tolerating them? So I think we're all of the 3 of us would be big proponents of glucose testing periodically, absolutely, or daily.
Well, knowledge is power. When you know
Yes.
more about what's going on in your body, and you can't unsee it, especially if you get some education to help interpret those numbers, what they mean.
Yeah, you can get immediate feedback, as if you do decide, I'm going to start to do a morning walk or an evening walk after dinner, and you want to see what an impact does that have on your blood sugars after that morning meal or evening meal. You have that device to be able to give you that information in real time. So it's pretty neat.
Mm-hmm. We have a couple questions about using something other than metformin to control blood sugars. Do you guys see that in the chart?
Yeah.
Chat?
Claire, do you have any background on that?
I'm not familiar with that. If it's a prescription medication or is it a supplement?
I believe it's a supplement. And
is it the cinnamon one or no?
No, this is a new one. I read a little bit about it. But I think in general, just probably good to have both your opinions on taking supplements instead of prescribed drugs for managing diabetes. It's a tough question.
Well, I think there are plenty of supplements that what they claim to do or what they may do is to help you metabolize or utilize your sugar more efficiently. Okay. But will it have first of all, has it been studied? Do we really know what it does? And is it going to have an effect that's as effective, I should say, as one of the medications that's prescribed? So I'm not, I know most of us here would not be anti-supplement, but we want to make sure it's safe and that the focus isn't all on supplement that may or may not be working, like do some glucose testing and eating healthy. And, it's talking about that supplement with your provider, so they know if you're taking metformin or not taking metformin. I see metformin as so effective. It's just sometimes exactly what our body needs. What metformin does is it helps us use the insulin more effectively, whether we're making the insulin or you're taking the insulin. It's helping your body use it more effectively. And so to just not take it when your blood sugars are really high, thinking that the supplement may help, may not always be the best path to go on. So I guess I would.
It can also sometimes have interactions with other medications you might be on. And if it's not studied well, we don't know what those would be.
Yeah. And I recall plenty of conversations with Elizabeth when we were working together, providing medical nutrition therapy, diabetes education, of lots of questions come through of and trying to do our best while we have someone right there with us to go through the research, some of the trusted sources online to see if there's any contraindications with other medications that someone may be taking. Just thinking about cost benefit, and unfortunately with individual nutritional supplements, there usually are not good studies. There's not large clinical trials, and so not a lot is definitive. It's not really evidence-based. So it's and then I know I've had conversations with Elizabeth about proprietary blends and really trying to read that label and be familiar with what actually you are taking. So I can't say I know a lot about berberine myself, so I would have to do that research in order to kind of come up with my own thought or feeling about it. And that's what it comes down to with supplements is what's someone's personal thoughts about it, and if they go through and look at the research, do they feel comfortable to give it a try? And then again, hopefully a meter or getting some sort of method to see how it's working for you would be important.
Sometimes you can consult with a pharmacist too. That not all pharmacists, but some pharmacists have expertise in this area. Sometimes physicians' offices, if it's a large practice, they may employ pharmacists who could investigate it if they're not familiar with it too. And dietitians and diabetes educators, we do the research, but again, sometimes there's not a lot to look at.
Yeah. Yep. I was just thinking of the cost involved in that. It's a market. It's definitely an industry and a market, and a lot of money is spent in that market,
Right,
without a ton of evidence that it's helping. It's definitely not helping the mass majority of people. So really focusing on the behavior changes that we know are tried and true and work, I think is most valuable.
Someone has a question about confusion between your A1C test and your finger stick blood sugar.
So the A1C is certainly helpful, but it's going to be, it's a 3-month average sugar. So what they're doing, basically our hemoglobin lives for 3 months, and they're in the way I see it is that it's measuring sort of how much sugar has interacted with that hemoglobin over that 3-month period. So that's how you can end up getting one blood, or from one blood draw get one number, or one number on the scale, 6.5 or 7.2. So it's an average glucose, which is helpful, but you have to remember it's looking back at the past 3 months, where the finger stick, or a continuous glucose monitor, which you see a lot of advertising for Libre or Dexcom. What those do is give you glucose numbers in real time. This is what's happening now. This is how this is how my body reacted to this kind of food, or this kind of exercise, or this medication. So, when people test a finger stick, I always say, please make it meaningful. You don't want to test randomly. You want it to be a first thing in the morning is generally really helpful to know what your blood sugar is before you've eaten anything. Maybe do what they call paired testing, where you test a blood sugar before the meal and then 2 hours after. So you give your body a chance to digest and your body to use that sugar and metabolize that sugar. Does it go up and then go back down again? Like, what happens? So I would just say, I feel like when someone comes to see me without finger stick testing or a glucose monitor, it's almost a wasted visit if they're having diabetes treatment. At this point, I really need to see some numbers. The A1C is just not enough.
Whoop. There we go. That's that myth again. Whoops. I have to, whoop. Where'd that go?
Elizabeth, were you monitoring the chat? I think there were a couple other questions.
Yeah, I was trying to, and then I got distracted.
Yeah, we can look at the chat.
Well, one of them, came just a little bit earlier on, but it was asking about weight changes related to diabetes diagnosis. So I didn't know if we wanted to go ahead and.
Yeah, we can talk about that one, definitely.
So I think clinically, if someone's blood sugars are trending really high, 200s, 300s, and if it's a type 1 situation where the body's pancreas is no longer producing insulin, that is what would continue to happen, is that blood sugar would just continue to rise. And so if that's occurring, weight loss is actually more prevalent, is what would be seen in a clinical setting. Because without the insulin, then the energy that's actually being consumed by carbohydrate isn't being absorbed and utilized. And so you're seeing sort of a wasting situation within the body where you'd be losing weight. But for individuals where it's more of a type 2 process occurring in the body, type 2 diabetes, where there's insulin resistance, then the carbohydrates that's being eaten is just not being utilized that efficiently and stored. And that's where you would more, depending on the lifestyle, what's going on, weight gains may be more typical. If that sounds right for both of you guys.
Mm-hmm.
Chime in.
Mm-hmm.
Right.
I think we're going to move on to the next slide. Oh, we already talked about this one.
Yeah, and what can I just say that for people who have had diabetes for 10 years, 15 years, 20 years, they start losing the triggers that they normally have to tell them their blood sugar's low, 70, or blood sugar's high, over 200 or 250. And so now maybe they're not going to get that trigger, that jittery feeling or that shaky or hungry feeling until their blood sugar's 40, or 50. And then now it's kind of panic mode trying to get that blood sugar treated quickly. So that's another reason why a glucose testing is so important.
Yeah.
Next
slide, Roger. Whoop. Oh, a lot of people get confused about this, that if you are put on, start to take insulin, your diabetes turns from type 2 to type 1. I think people get confused about the insulin thing.
Yeah. So sometimes, so should we talk about the difference between type 1 and type 2 then? Would that be helpful?
I think that's helpful because a lot of people don't know the difference.
Right. So in basic, and just jump in, Claire, but type 2, well, type 1 diabetes is that your pancreas just stopped making insulin. It may be somewhat gradual, but usually it's pretty dramatic. And it can typically happen when someone is quite young. It could be a young baby, it could be a school-age child. This could be a lot of, variations in age. We had actually someone come into our office who was 78 years old and diagnosed with type 1, like, never had diabetes before. But basically, her pancreas stopped making insulin. With type 2 diabetes, it's more about how you're using the insulin. So your pancreas is making insulin, you're just not using it effectively. Your cells are not allowing the insulin to do what it's supposed to do, which is open the cell and allow the glucose to come into the cell to use the glucose. So now your glucose on both type 1 and type 2 gets stuck in the bloodstream, and your blood sugars are high and your A1C is high. Either one of those, type 1 or type 2, you may at some point need the help of insulin. Getting to this question. So just because you now start, my dad has type 2 diabetes. He is on, I call it a whiff of insulin. He's on a little bit of a long-acting insulin. He takes once a day at night, 12 units. He still has type 2 diabetes. His body just isn't making enough insulin for him to cover his morning blood sugar. So whether so using insulin or not using insulin, it does not define whether you have type 1 or type 2.
Anything you want to add, Claire, to that? Or?
I don't think so.
Okay. We have a question about, do you lose your appetite when you have diabetes?
And there was also a question, I think, that I just saw pop in, that what are the symptoms of diabetes?
Yeah.
So I guess that could all go together.
Yeah.
And on one of the slides, we had showed some symptoms of diabetes, which are the symptoms of elevated blood sugars, which would be increased thirst, increased urination, hunger. So maybe changes in some of the digestive patterns of fullness and hunger being somewhat, off maybe than what might have been typical of yourself in the past. Anything else you would add, Marie?
Those symptoms, I think, like you said, some people lose weight, some people gain weight. I wish we could say that everyone loses their appetites, right? But they don't. There's plenty of people who say, I'm more hungry than ever. I just feel like I can't get satisfied at all. So because your body's craving more and more sugar because it's getting stuck in the bloodstream, right? It's not getting into the cells where your body can really use it. So you feel like you're just not getting enough food. So unfortunately, I'd say, no, you don't necessarily lose your appetite.
And maybe, on top of that, as anyone, if you think about sort of how you feel before a meal, how you feel after, how you might feel after Thanksgiving dinner next week, is that, same with that satiety is maybe also your energy levels kind of swinging along with how you're feeling as far as your digestion is going. So maybe you're alert or feeling more fatigued after a meal, or maybe, more tiredness happening. Sometimes individuals will describe changes in their vision. If blood sugars are high enough, they may be having visual feelings that are things are changing there too because of the pressure.
When I would work in the hospital and people had ketoacidosis, now that's really when your blood sugar is really high and it's very dangerous. You might be on an ambulance trip to the hospital. They might lose their appetite, but that's in a very extreme situation.
Right. Is it okay if I just jump into one of the questions that was
Sure.
scrolled a while ago, and I just wanted to quickly,
Yeah.
before we move on to the next about food. Someone asked about with kidney disease, can you make a difference really when, if you, with they said specifically type 1 diabetes. So type 1 diabetes or type 2 diabetes can affect your circulation. Really, that's what it's all about. So think about where you have tiny blood vessels in your fingers and toes, your kidneys, your eyes. So these are all areas we look at very carefully when someone has diabetes, particularly high blood sugar. So some people will have some changes in their blood tests that will show that their kidney is not working so well as a filter or not working so well. But when people get better control with their glucose, get their blood sugars down and their A1C gets back to normal, over months, you can actually see a bit of improvement in the kidney function. Just like you might have less tingling or burning in your fingers or toes when the blood sugar comes down. There's a lot that can happen. So I just want to say it is worth it to get, even if you've felt lousy, like the symptoms that Claire was just talking about, feeling tired and, urinating a lot and, your appetite changes. When your blood sugar gets under control, people will say to me, I forgot what it feels like to feel good again. I forgot I could feel this way. It makes a difference in your circulation, how you feel, how you could think. So if glucose control can, yes. So the answer is yes, you can make a difference in all those places.
Well,
Yeah.
also,
Go ahead, Elizabeth.
I was just going to say there was a question way back about pain due to neuropathy in hands and feet. And that's kind of the same answer, right, Marie, that it might help, there's no guarantees, but it can help.
Yes. I worked with a physician who said people would come in asking for pain medication for the neuropathy, and he wasn't against the pain medication, but he said, first, I want you to take your diabetes medication and test your glucose, and then we'll talk about if you need pain medication. You know what I mean? Like sometimes first, let's get those blood sugars under control and see if that helps. It's, can be quite dramatic.
There was a question on bitter melon, and I think that's a similar answer to when we were talking about the berberine, that the natural alternatives do have potentially, can have side effects or interactions with other medications. So, we just don't have a lot of research on them in order to, sometimes use them clinically.
Yeah, as much as I would love to believe, that would be the case, I always, just for myself, think about how much of a food or ingredient has to be put together to make that pill have the level of what it's hoping it could be medicinal for, that would never be an amount we would eat naturally in nature. And I always just kind of think about that a little bit.
Yeah.
But again, that's just sort of personal opinion, and that's not typically what we obviously would bring to practice in speaking with someone, a patient with diabetes, but would have to do the research on your behalf or guide you to resources where you could do that research for yourself.
Right. Reliable resources.
For safety and sort of, cost effective.
And also there's sort of it makes me think of a really practical way to look at that. Like maybe the bitter lemon would help, or bitter melon, would help, or berberine, or, lots of different supplements might be helpful. Apple cider vinegar, that's one that you hear a lot about. But if I'm doing that on one hand and then drinking soda on the other, regular soda, I'm sabotaging, diabetes care no matter what. Like really looking at the whole, right, Claire? I think you would agree. Looking at the whole picture. How are you eating? Or what's your lifestyle like? Looking at everything. Just to focus on one supplement doesn't do it. Doesn't make enough of a difference.
And there was a question about nutritional strategies for management and reversal, and I think we've talked about a lot of them. Maybe we need to summarize them, but personally, I think talking to a registered dietitian or a diabetes educator is they can individualize things to your situation, which is a real advantage, as opposed to reading something. Reading is great, but sometimes you need that individualized care. But
And both Lisbeth and I are dietitians, public health nutritionists with SNAP education programs. So our funding comes from the United States Department of Agriculture. And it really is a wonderful wealth of nutritional knowledge that you can easily access online. I can put the
that'd be great.
web address right in the chat. Do all the participants see the chat? Or
Yeah.
maybe Roger's able to? Okay. But it's just myplate.gov. But it has a lot of information specific to age, sort of lifespan, how things change across the different age groups. So that's helpful. Tons of recipe ideas. They've really revamped a lot in the past few years. So different cultural recipes and a lot of good things, and a well-designed, user-friendly website. So I would encourage that. When I was providing diabetes education and discussing nutritional management, it was kind of targeting the carbohydrate foods and understanding that those foods break down to sugar in our bodies. And so really trying to educate individuals on sources of carbohydrate, so fruits, dairy, definitely all of our grains, our cereals, breads, rice, all of our grain food starches, and just starting to look at ways to control portions, ways to be able to read a food product, the food label, to understand carbohydrate content. And then, working with someone to develop a plan for having more knowledge about how much carbohydrate, and then ways to sort of improve the meal, an overall meal, so that it's satisfying, it's appealing, it's flavorful, but it also doesn't have a huge amount of carbohydrate that would obviously negatively impact the blood sugar levels. So it is kind of about carb management. Marie, Elizabeth, do you feel that it's changed, or that's really where we go with managing blood sugars?
In my practice, we talk a lot about carb counting, or in general looking at, might be just a healthy plate and portion sizes, as you said. But yes, absolutely. We used to talk about, in carbohydrates, how fast the carbs metabolize versus other foods that metabolize, excuse me, more slowly. But really the carb content matters the most, how much are you eating, and how does your body handle that? So yes.
Yeah, again, in tandem with if you were testing your blood sugars, as you can see how your body might digest food differently at different times of day. So in the morning, if we tend to be a little bit naturally insulin resistant, we might be a little bit more sensitive to carbohydrate in the morning than we are midday or in the afternoon. So kind of seeing those sort of response. But overall, even if you sort of do look at the healthy plate on my plate, and you see that image of half of your plate of vegetables, a palm-sized maybe protein, and a fist for what might be the starch heavier carbohydrate rich food. And just that image alone, and really looking at a lot of recipes in that image, and then finding fun ways to design your own menus similar to that, is really sort of the direction, I think, a visual direction that sort of public health has gone to be able to reinforce or educate individuals on healthy eating.
Yeah, I used to use that in my clinical practice when I was doing medical nutrition therapy or diabetes education. That image of the plate is so easy to apply.
Yeah.
And it also reminds you that it's a balance. I mean, carbohydrates can come from a variety of sources, but it's moderation and distribution. Not eating them all at one time allows your body, to have a chance to move it from your bloodstream into the cells. Spreading it out over the day and not overdoing it is really the key, as opposed to avoiding these foods that are important, for the nutrients in them. we do need carbohydrate. It's just sometimes we eat too much of it or we're not spreading it out enough.
Yeah, I know how, we're all busy and managing our time, but the more we can prioritize nutrition in our lives and think ahead and prepare for what your week looks like and your family's week, you can really, put some really nice practices into place to help yourself be ahead of the game versus, scrambling when you do have that feeling of hunger.
Yeah, planning is a lot. There's a myth here that sugar and fruit is a bad choice for people with diabetes. And I think we've kind of touched on that here and there, but I don't know if you want to expand on that. Or...
I think it's a great choice for people to have some fruit in their life. I just ask people to space it. Like you were saying, it's distribution and portion size, right? So it's about spacing it throughout the day. No one would say, you can never have an apple again or a strawberry. That would be a shame. It's just about the amounts. And for a lot of times I'll ask people to have maybe a little protein with that fruit, maybe some almonds or some, peanut butter and with the apple, if they feel like they need a little bit something more substantial to get them through the morning, because the fruit will kind of digest pretty quickly. But that's what I tend to talk about in my practice. I wouldn't say that it's all bad.
No, and it's wonderfully good, right?
Yeah.
We want all of the antioxidants and immune fighting properties that are in those fruits. We want color and variety, and we want to enjoy it. So hopefully you do. So it's just finding what works for you and thinking about what impact does it have different times of day and using your blood glucose meter to be able to figure that out. I also thought of too, in the instance where if someone were having a low blood sugar response, fruit might be the exact thing to go for, or even a small amount of fruit juice to actually help correct low blood sugar. So it is a quick source of energy for our bodies. And when it comes to the whole fruit, it comes, with all that the added vitamin and mineral content too. So
maybe some fiber.
Okay.
I would love to hear your thoughts, Claire and Lisbeth, on the question about drinking diet soda.
Oh, I knew you were going to make us do that one. Well, I'll let Claire answer. It might be, it's a hot subject.
Yeah, and I know there's some studies out there as do sugar substitutes, because they're so sweet, still impact our body in some of the same ways that if a soda had sugar would. I would say it's still a better choice. It's that much less straight up sugar. So I would go with diet soda over regular soda for myself, and I would recommend that. But depending on people's personal feelings with sugar substitutes, that would be up to them. I don't know if I felt that the research was leading enough to say that it's a problematic choice, but I do think it's something to think about, is how much affinity do you have individually for sweet? And I think that's just an important thing to think about, is our palate and what we want to taste. And there's a lot of other things in the diet soda, again, that might be a personal issue, whether it's, phosphorus because of kidney issues, or if it's dyes or caffeine and children in the house, of, all of those types of added ingredients would be things that you'd have to consider for yourself. They're allowed, the Food and Drug Administration allows them in our foods, so they're considered safe. But it would be up to you, I guess. And I know those are just some of the research and the buzz about all of that. I still think it's a better choice than regular soda, and maybe just think about the habit or behavior overall and how that might impact your palate and your other food choices.
I agree. And I think you have to really look at some of the studies that are out there, in that they might link to things, but that doesn't mean that there's a cause and effect. By that, I mean, there might be a study that suggests something, but sometimes in the media it's presented as a fact, and that's not really the case. You can never have a fact based on one study. It's just That's not a fact. And it has to be a good study and a variety of things that you have to evaluate. And that's what we do. You know, we evaluate the research, whether it's something that we will share with the public or not necessarily share if it's not good research. And a lot of the non-nutritive sweetener studies aren't all that great research, is my opinion, based on, you know, the different things about the research. But as Claire said too, it's, you know, it depends on the person. I have come across a couple people, not very many, who tell me that when they drink diet soda, it just kind of keeps their sweet tooth going. It's very rare I would come across that, but you know, there are those people out there that kind of like once they get hooked on, you know, a taste, they just keep going with it. You know, kids do sometimes. They get on a food jag. So it's very individual whether that's a good choice for you. But we do know that regular soda is all sugar with, you know, maybe some caffeine and coloring thrown in. So that's definitely going to be a problem for people with diabetes, for their bodies to manage that.
Your dentist isn't going to love it either.
No, you know, I wouldn't say you couldn't, you know, work in a tiny bit, but is it really, you know, is that really in place of something like fruit? I don't think I would necessarily recommend that.
And when it comes to beverages too, you definitely hope that you're hydrating enough with water.
Yeah. Hope we answered your question, Marie.
Yeah, you did. So should I, does type 2 diabetes cause high blood pressure?
Oh,
Was one of the questions, and no, it doesn't. Sometimes you'll hear something called metabolic syndrome, where people have a triad of conditions, high blood pressure, high cholesterol, and high blood sugar. So, but they're not there, and they may be sort of have some of the same sources, you know, of problems, you know, maybe overweight, lack of exercise, you know, different food, some of the food choices that might be contributing to all three of those things. But the diabetes is not causing high blood pressure, or is the high blood pressure causing diabetes? So I just wanted to be clear on that.
yeah, I saw that question too. Thanks for answering that.
I think it's maybe also important to note that if someone does have a variety of health conditions, that they can end up, you know, becoming even more harmful when combined. And so if you hear about statistics of individuals with diabetes being more at risk for chronic, like cardiac conditions, that's the processes happening together are an added risk for an individual.
Well, I think we're going to have to wrap up. I just looked at my watch, and Roger, our communications director, who does such a great job, said, guess what? We're almost done with our time. So I want to thank Claire and Marie so much for sharing their expertise and their time today. And I want to thank our audience for all the wonderful questions and your thoughts. I hope you'll join us next month for Ask the Expert, the Nutrition Edition, when we talk with Allie Hook. She's from Franklin County, and she'll be joining our SNAP-Ed team in January. And she's going to talk about budgeting for a healthy diet. That's a pretty important subject these days as food costs go up. And we'll be talking to Allie on Friday, December 9th at 1 o'clock. And we also have a new What's Cooking with NYSOFA episode coming up on November 25th at 12:30. Wendy Beckman, another registered dietitian with the New York State Office for the Aging, will be making a delicious recipe called Brussels sprouts, apple, and sweet potato hash.
Ooh.
I like all of those, so I can't wait for that one. And this episode of Ask the Expert was funded by the United States Department of Agriculture, which is an equal opportunity employer. And I just can't say goodbye without thanking Marie and Claire so much for being here today. It was great to get together with you guys again.
Good to see you both. Thanks for having me.
Thank you. It's fun.
Take care.